Thanks to all our panelists for this very, very important hearing. I kind of want to follow up a little bit about not just the assisted livings, but nursing homes in particular. My mom is in an assisted living, so it has been a challenge for all of us, and especially her. Over the last few weeks, we lost Dad in December, so the isolation has been a struggle. But we lost Dad to Alzheimer's, and I think it has been particularly tough on Alzheimer's patients and caregivers. Those forms of dementia create special problems regardless. It's been sad to listen to. My mom has been talking every week. She will mention that she, as much as she misses my dad, who she was married to for 70 years, she's also somewhat thankful that he passed before all of this pandemic hit. And in part, I think that is because of the problems that she would have faced. She used to go down and visit him every day, and that's especially troubling. My friend John Archibald, who writes for AL.com, wrote an article this week called "Coronavirus Creates a Special Hell for Dementia Caregivers," and he talked about trying to imagine what it's like for an Alzheimer's patient or caregivers. Imagine what it's like to try to explain social distancing to a person who does not share your reality. And he quotes Pam Leonard, who's a program director in Birmingham of the CJFS CARES program. And she talks about caregivers and said it's kind of like being on an airplane. You got to take care of yourself. You got to put on your own oxygen mask before you're able to help those around you. So I'd like to get to anyone on the panel, given the special and unique needs and challenges that we're seeing, what we can do to more support individuals with dementia, both in these facilities and out, and their families and caregivers. And are there special trainings that might be needed for any of these long-term care and dementia facilities in a situation like we're in now, which we've not seen before, but we could see again? I'll open it to anybody.
Senator Jones, I really think that you've touched on something so important. I think as a society, we will always be judged by how we take care of the most vulnerable. And certainly our demented seniors at this point are among the most vulnerable. They're not able to express, for example, if they are becoming ill, they wouldn't necessarily be able to express that they don't feel well, that they feel hot, that they're short of breath, et cetera. So they have medical as well as the sort of psychological, emotional vulnerabilities at this time of this pandemic that are unique to them, I think. And I don't know that I have any specific answer for you, but I would encourage any effort to bring together a think tank to brainstorm about this. I think it's absolutely needed. So thank you for raising it.
Senator Jones, thank you for raising this critical issue, and I share your deep concern for the well-being of people living with dementia. And actually, one of the sad parts about all this has just been hearing my staff explain what's going on when they're doing nursing visits with older adults with severe dementia, and in cases when they've had to do a test, those nasopharyngeal swab tests, for example, that's in some cases been fairly traumatic and upsetting, even to do the test, because the person just doesn't understand. And so one thing in the assisted living and independent living, because that's been a big topic in this hearing, we should point out home health agencies are able to come into those settings, and as are hospice agencies in certain instances, to buttress the care in those facilities. So to the extent that we continue to have a strong home health option and focus on the things that Senator Collins is focused on around telehealth, I think that's going to strengthen dementia care and assisted livings, and also encouraging people to focus on goals of care and family caregiving plans also can help, but really tough issues we're facing.
Great. Well, thank you very much, both of you, for that. Dr. Konecka, real quick, as my time runs out, you have your research has indicated so that racial and ethnic minorities and low-income individuals have been disproportionately affected, with nursing homes that have larger minority populations more likely to have coronavirus cases and deaths. I think there's an article about that also in the New York Times. Could you briefly share more about what factors might contribute to those disparities?
Yes, thank you for that question. So disparities in nursing home outcomes from COVID are not unlike disparities we see across the healthcare system. And it's the result of many years of differences by race in health infrastructure, in resources, in risk factors of populations. What we found in our research was not necessarily that non-white residents were having worse outcomes within a facility. It was about the percent white in a facility. So to me, it's really about the neighborhoods in which nursing homes are located and staff going back and forth between those facilities and the neighborhoods. So I think it's a lot about where the virus is circulating and who is in those facilities and who is going back and forth.
All right. Well, thank you. And thank you, Madam Chairman, for holding this hearing. It's very, very important. Thank you.